Hi, and welcome back to the New Patients Now podcast. Really actually looking forward to digging into the topic for today. So, in working in practices, in dealing with patients, as all of you do, right? Whether you're the doctor, you're an office manager, maybe you're a team member, hygienist, who knows, right? So one thing that we all have to do at some point, as uncomfortable as it might be for some, is that dirty S word. Yes. Sell, right? I don't know if you thought that's what I was going to say, but it is sell. So in your practice, right, it's the presentation of the case to the patient. And ideally, right, it is what is going to make them healthier. It's going to get them the result they're looking for, whether it's cosmetic or whether it's for function or whether they're just in pain and we're trying to solve that, right? So what I want to talk today is the modern approach to how to effectively present treatment to your patients, right? So I want to kind of talk through what's going on behind the scenes with your patient, what you might be missing, and some of the things that we have found to be hyper effective that you can take and use in your practice with your patients like today. So let's go ahead and dive in. When you really dissect this, right? What's happening when the patient is in the chair, you're getting to that point, right? They've gone through the in-office experience. Hopefully it's been a really great one, right? Because that is a huge component of this. But then they're there. We have done the diagnosis. We know what this patient needs, and you have to take the step to present that case in a way where the patient sees the value, right? Now, what is it that they have to value? They have to value what you are going to do for them, right? Another version of that was like, how are you going to help them, right? So when you are doing treatment, when you are serving your patients, you are helping them in some way. But if you actually think about like how we as people, and this applies to you, it applies to me, and it applies to the patients who come into your office, you have to consider the psychology of how and when people are actually willing to ask for and accept help, right? So like I remember when I first got to my first summer in college, right? So I was going to college and I went up early the first summer because, I was like, I got to get a head start, like start working out with the team and get ready for the season, right? So I was playing football and it was like, okay, I'm going to get up there early. I'm going to get ready. I'm going to start taking some classes so that like once we got into the swing of it, right, I was not as behind the curve, right? Maybe I could take a few less credits in that first semester with the season going on, right? Because I didn't know how I was going to do acclimating to that workload and stress load and all those things, okay? And what I heard probably 300 times, right? I might be exaggerating slightly, within my first couple of months on campus, right, was this consistent phrase: don't be afraid to ask for help. Now, and I kept wondering to myself, like, why do they keep saying this? Like, why do they keep saying, don't be afraid to ask for help? Like, isn't that what people do? Isn't that like, when you need help, isn't the whole purpose to ask for help? But as I think back to that, the only reason they would have to say that so many times is because there are so few people who, when they are in that moment and they need help and they know that they need help, they even ask for it. So let's look at this through the eyes of your patient. They need help. They may walk into your office having no idea that they need anything from your practice. I walk into an office, I assume everything is fine because nothing hurts, right? You sit me down, you look at my teeth, you look at my back, whatever it is that you do in your practice. And then all of a sudden at the end of the appointment, when I think, okay, great, time to get out of here, no, I'm actually met with something different. I'm met with you telling me that I need help from you for something that I wasn't aware of. And if you take the other example, I came in, I have pain and I need help, right? And it's, am I going to be willing to accept the help? So before we talk about any of these like tactical strategies, you have to understand what you're really having to overcome here every time we present a case to a patient. It is either getting them to agree that they need help and then actually to accept that and to comply with that and all those things, what we'll talk about. But there's also a lot of people who even know that they need help and will not ask for it. It is how so many of us are wired. And what you'll find is actually like the most successful people in the world are actually the ones who are just really, really good at asking for help and getting support and guidance in the areas that they're not experts in. They don't know how to fix those things, right? And so that is kind of another topic for another day. But as we dive into this, what we're trying to solve for is ultimately that core human element of like, I don't want to ask for help. And even if I have a problem, I might not be willing to ask for it because I'm scared of the judgment that comes with that, or I'm scared of what that's going to cost, or I'm scared of what that is going to, how it's going to impact me, right? So all those things you have to understand. That's what's going on in the mind of your patient before we even get into this process. And the reason I'm spending so much time talking about this is because if you can think about that, right? You put yourself in the shoes of the patient and you say, okay, this person's coming in here. They may or may not have any idea that they're going to need something from our practice today, other than what they assume, which is typically not very much, right? Well, that changes how you approach everything. And if you can look through that kind of glass, if you will, like put those glasses on and go throughout your day, right? Not the meta glasses, but it's almost like the human psychology glasses. You're going to find that you actually can execute on these things better. So let's go through a few of the things. And ultimately, we have to start with what is broken, like what in the system, what most practices, most doctors, most team members are doing is not hitting the mark, right? And so in working with thousands of offices and tens of thousands of team members, honestly, hundreds of thousands at this point, right? We've kind of figured out, okay, where do people get it wrong? And then we can talk about what you have to do to fix it, right? And it's 2025, and there are things that you have to consider today in presenting cases to your patients you did not have to think about in 2000. You did not have to think about in 1992, right? In 1999, you could have had a patient who came in and said, well, I'm not going to do any of this work because the world is ending at 2K, right? And well, they were wrong. And 25 years later, they're probably still looking for some type of excuse to not move forward. But maybe this will help with that. All right. Number one, the first thing that people are doing wrong that you have to stop doing. And this applies to case presentation, and this applies to any time any person is trying to sell anything. You are talking too much. There are only a very few there's maybe 2 or 3 things that happens when you just keep talking and talking and talking and talking. And, some people will get upset about this, but, there are doctors out here who will say, they'll be like, well, Flint, I really build a great relationship with my patients. That time I'm spending talking and just blabbering on and on, that's kind of my secret sauce. That's really what does it. That's the magic. It's like, well, I can almost guarantee you without question that everyone on your team has a different opinion of that. And if you stayed more on track, you would have less patients waiting. You would have team members who could actually get more done, and you are unknowingly bottlenecking the capacity and the productivity of the office. Now, no one else is going to say that to you, except for probably me right now, or the one person who brought it up to you and you just dismissed it, right? That's in the office, but they're actually trying to help you, right? So when we over talk in the presentation, and we feel as if we have to explain every single little detail, mind you, that the patient doesn't understand or they don't even know the words you're using, that actually doesn't help, right? And understanding how that specific patient accepts information can be a huge determining factor in that. Because personally, if it's me, and I got a 25-minute dissertation on what it is that I need, why it is that I need that, the scientific evidence behind that, right? I'm the kind of person who my eyes are going to glaze over, and then 15 minutes into the 25-minute presentation, I'm like, actually, I have to go. Can you just send me something about this? But if that was delivered in a concise point of view that was actually tied into what I need and want and any reason that I might not move forward, right? I'm actually a pretty easy sale unless you throw all that information at me. Number 2. So number 1 is just talk less, right? And you're probably not asking enough questions earlier in the patient's appointment to understand really what they're looking for, what they need, right? We're so focused on the clinical component of it that we think that that's going to sell everything. The reality is that is not going to sell everything. The average case acceptance rates across the industry are honestly kind of abysmal, and it's because we think that clinical sells. But it doesn't. Clinical does not sell. It's when you combine the clinical with actually understanding the person who's sitting in the chair and how those clinical facts, right, the diagnosis is going to improve the life, create value for the patient who's sitting in the chair. So let's go to number 2. You are under preparing or you're under practicing. Too often we'll go into a case, and I'll see this all the time, and the presentation does not get practice at all without a patient being in the chair. So ask yourself this. If you were to try and go and sell something that you don't 100% understand, right? And right now, what we're really talking about is if there's a team member in the office who is doing the financial presentation. So if you have a financial coordinator or treatment coordinator, right, and they're in the practice, and you as the doctor, maybe you explain the clinical side, and then you hand it off to this other person who is not clinically trained, who knows some things but not everything, but they also are not actually practicing and being trained on how to present that in the best possible way, given what has just occurred, right? Way too often, we are just throwing people in saying, hey, here's what it is, and they're doing all kinds of things that are incorrect, like talking about the price instead of in front of other patients. They're not presenting things as positives. They're always presenting things, oh, well, it's going to be a little expensive, actually. You see, unfortunately, it actually comes out to be about $7,207. Like that tone drop of, I am now not confident at all in what I'm saying to you because I am so uncomfortable talking about how much it's going to cost you to do this. And I am not even going to spend a second talking about the positive benefit and outcome that is going to come from doing this for you as the patient, right? So these are mistakes we see all the time, okay? Number 3, assuming that treatment acceptance, case acceptance, is only up to the doctor. That could not be more wrong. There are doctors who cannot sell anything at all out there, and they have teams around them who have great systems and are well-trained, and they convert very well because they own their little area, and then the team has a system that does the rest. So to think that, like imagine this, if I were to call into your practice and you don't answer the phone, right? And then I call you back and you don't answer. And I call you back, you don't answer. And I call you back, and you finally answer. And then I talk to somebody on the team, and it's kind of difficult to actually get on the schedule because they're not prepared, right? They don't know when the next openings are. They're not really guiding me through the conversation, right? At this point, if I haven't already given up, which most people would have, right? I'm thinking unavailable and kind of cluttered and like not a really great system. Then I show up into the office. And then I get the stereotypical in-office experience of walk in, sliding glass door. Hey, here's your clipboard. Go sit down, fill out your paperwork. We'll get with you when we can, right? And this doesn't happen in your office. It happens in other people's offices, right? These terrible places that you don't live in, right? But you get to that point, and all of the things I've experienced up until that point are without question going to impact whether or not I say yes to treatment at the end of the day. So we always think, and every time I talk to someone about this, like, how do I increase my case acceptance? What can I do to increase my case acceptance? I'm not even going to tell, if you're the doctor, I'm not going to tell you anything. I'm going to look at what is the process and the experience that the patient is going through before they ever meet you. Because that is killing more conversions than what you say to the patient. I promise you. Now, once we get to that point, there are things that we have to do. We got to stop talking so much. We got to ask more questions, right? But all the things that happen before that are ultimately what is actually stopping you. It's shaped by the phone call, the front desk, how we hand off, right? And ultimately, how I feel when I walk in. Okay. There are studies that show that case acceptance can be dropped by 30% by inconsistencies in your presentation. Okay. So when we talk about under preparing and under practicing, when you just go in every day and wing it and you don't commit to, here's how we're going to do it. We're going to track how it works. We're going to make tweaks on specific areas. We're not going to go in and change everything about it every single time, right? If we're consistent, if we focus on the entirety of the experience and we actually do some preparation and training, as well as listen and ask more questions, right? Well, that's how you can combat a lot of things that are broken, right? So let's talk about a three-part, like three things you want to focus on, right? And ultimately the process you want to take patients through to make this more effective and a better process in your practice. Okay, number one, you have to get the patient to accept the fact that they need help, right? So it's like when you go to right, AA, right? What's step one? Acceptance, right? There's a reason those 12 steps work. They're hyper effective. Like they work with pretty much anything, right? I mean, you could probably say, well, I know someone who didn't work on it, but that's not the point. The point is step one is super important because go back to the beginning. People do not want to ask for help even if they know they need it. So what do we have to do first? You don't have to get them to buy the treatment. You don't have to get them to comply with the fact that they need to wear the retainer so often and so frequently, right? No. Step one is get them to accept the fact that they either need something or there is something that could add value to their life that you can offer, okay? They have to accept the fact that your office is the right place for them. They have to accept the fact that they need the help that you're offering. They have to accept the fact that if they got that help, they'd be better off, right? All of that has to occur before they actually ever sign on the treatment plan, okay? So they have to accept, right? Next, they do have to buy, right? There has to be some type of a financial transaction unless you're doing a free treatment day or something like that. But you can't do that every day because then you'd have no money and you couldn't pay anybody and the practice would close down. And then, well, I don't know, we'd have to start all over again. But, right? So they have to accept, then they need to buy, right? This is where you actually have to ask for money. And very often you have team members and or doctors who are very, very uncomfortable asking for money. And the psychology that breaks down here, right? And we do a ton of work with financial coordinators and associate doctors even who are kind of newer out of school. And what you find is they're so uncomfortable asking for money, especially when you're talking about higher value cases. Because the more expensive the case, the less likely that person is to have ever spent that amount of money on anything in their life, far be it from a dental procedure or some cosmetic work or whatever it is that you do, right? So what you have to understand, if you got somebody who's in a job asking for money they've never spent on something they have never spent it for, how do you think that is going to go? Like logically, what would you expect the outcome to be, right? And yet there's so little work that's done around this. And so in order to get them to buy, this is where like you want to be able to use some influence levers, right? So this is where, if you've read Dr. Cialdini's work on the 6 principles of influence, right? When I talk about case presentation and case acceptance begins from the first point of contact, right? So what you have to be able to do is apply the principles of influence, right? Which maybe we'll do a whole episode on that, to the entire experience, which is what we actually do when we go in and train offices, but it's how you present in a simple format that is understandable, that is actually curated and customized to the patient who's sitting in the chair, based on what's important to them, based on why they might not move forward and getting ahead of those things. And ultimately doing it in a way that the person who you are trying to get to pay you for the help that you are offering, right? For the help that they've accepted that they need and or want, right? What gets them to actually buy? They have to see that value. And you have to ask for it in a way that is effective, okay? And what's crazy is you do have to ask. If you don't ask, like too often it's just like, hey, so this is what the doctor talked about. And they just leave it there, right? If you don't believe me, 90+% of the phone calls that I listen to of new patients, the team member does not even offer an appointment. The patient has to actually ask for it. So if you think that in a world where we are not even able to always offer or ask for scheduling an appointment, that we are always offering and asking for payment on treatment, like, I'm not buying that at all, and neither should you. And if somebody says that to you, then you have to actually go through the process and look and like watch how that's not actually happening. Okay. So, all right. So number one, accept. Step two, they need to buy. So accept that they need help and want it, right? They want to make the decision and the commitment to buy, right? Whatever it is that you are offering, whatever the treatment is, it's going to be right for what they need, right? And then number three is comply. See, when you do those first two things right, that's where you actually increase your patient compliance and where they actually get the result that you're looking for because, right, not every procedure, not every case is just, here's what you need, we're going to do it. You don't have to do anything different in your life to make sure that it works, right? Very often, there are things you have to do. If I go to physical therapy and I got a back problem, right? Every time I have ever done this in my whole life, right? I played football for 20 years, basically. And I mean, every time I've ever gotten an injury and had to go to physical therapy, you know what? They can't just fix it. As much as I want them to be able to just fix it and be like, okay, I'm going to come in. We're going to do needles and cupping and soft tissue work and gym work and all these things. And it's going to hurt and it's going to be painful and I'm not going to like it. And the whole time I'd be like, man, this sucks, right? Then they're going to send me home with a list of exercises that I have to do to make sure that I actually get the result I'm looking for getting healed, right? There's instances in your practices where all of this is happening. So the reality of it is just to get them to accept the fact that they need help, to get them to buy the help that they need, you also want them to comply. The best possible outcome is patient comes in, they have a need, they're willing to move forward with what's going to get them better, and they comply with the steps that are on their end so that they get the best result as fast as possible. They're a happy patient. They refer other people to you, and it's a testimonial and a case study to the work that you do, right? That's what we're trying to create. That's what you want. You got into this, I would imagine, because you're like, oh, man, I have an opportunity to help people with the skills I have and the interests I have, and you're good with your hands and you're good with science, and there's this way to actually make a pretty good living in doing those things. But you can be good at getting people to accept they need help, but you can be terrible at asking for them to buy it. You might be really good at getting people to say yes to treatment, but because they never truly accepted the fact they needed it, they back out. They cancel on the appointment for the actual treatment. They're unwilling to put down deposits, right? And then if you don't do either of those, if you don't do both of those, you most likely have a compliance problem that's leading to you having to redo work, having to have patients come back in at cost to fix something that they actually did wrong, but because we didn't set that up in the presentation process, right? And this is why, making a few of these changes can be so impactful, is because you're probably good in one area and you've been ignoring the other ones, which is kind of what we as people do, right? It's like, I just lean into what I'm good at and I kind of ignore those other things. Okay. Now, let's walk through a few facts I'll leave you with, and then some really just actions that I want you to take. Okay. You're the doctor. You can't do this by yourself. You have to have consistency throughout your team. So if you if you go back to the episode on the gold standard checklist of patient experience, right? Go back to that episode. Listen to it. Go through that checklist. That is going to throw fuel on the fire of what I've talked about today. Okay. No one is going to move forward with a treatment that they do not understand. Okay. That's why the acceptance piece is so important. Right. And just remember your ABCs. Accept, buy, comply. If you can get a patient to accept what they need, buy it, and comply with what is required to get the result, you're going to have happier patients, a higher profitable practice, team members who are getting to see more transformation in the patients, and ultimately a better bottom line for you. So what do you do? What do we take away, Flint? What are how I got it? Sounds great. What do I need to do? All right. Number one, you need to map out your presentation. Okay. What are all the touch points? Where are the inconsistencies? Where are we doing things differently every time? Okay. Make sure you understand everywhere you are handing someone off, right? Every time a patient goes from one person to another in your patient experience, right? All of those little interactions, right? They're going to build up to whether or not they accept the fact that they're in the right practice at the right time to solve the problem that you are about to tell them that they may or may not even know that they have. Okay. And then number 3, you have to make sure your team is being consistently trained on how to do this well, from front to back. If that's something you need help with, go to our website, call our office. We're happy to have a conversation of like putting together some strategies with you of how to do that. But start there. Look at your existing process. Ask yourself, are we actually getting the patient to accept that this is what they need and it's the right thing for them? Or are they just nodding off and saying, yep, got it, Because as soon as you get the yep, got it, they're checked out. They're no longer engaged in the conversation of getting themselves healthier. And as soon as they check out of that conversation, you can say goodbye to step 2 and 3. They're not going to buy. They're not going to comply. And you're not going to have the happy patient who gets the result that you're looking to give them that you're looking for. So, hope that was helpful. If you liked what you heard today, would really appreciate if you rate the podcast, give us 5 stars, subscribe, tell people about it, right? Again, this is really the goal of this show, is to give and really show some of the tangible things and simplify a little bit of what's going on in your office, how to better serve your patients, how to really stand out from the other practices in your area, and things that I hope you can apply and see some change in your practice. And if you if you're interested in working with us and you're curious of kind of like how we actually apply these things in offices and implement them face to face, right? We'd love to have a conversation with you. But have a fantastic rest of your day. We'll see you next time.